welcome. You're watching NDTV. I'm Shekar. This is the show where we help you navigate the new normal as India opens up. Living with COVID is what we focus on. Life today is riddled with more questions than answers. We have a panel of expert doctors to help us answer some of those questions. Joining me on the broadcast today, Dr. M.A. Shekar. He's a director and consultant diabetologist at the Chordia Medical Center and Apurva Diabetes Foundation from Mysuru. We have Dr. Ravi Muppidi. He's an endocrinologist at the AED Hospital in Hyderabad. Dr. Nakul Sinha, he's a director and interventional cardiologist at the Medanta Hospital in Lucknow. Appreciate you, doctors, for sparing the time of day. You know, as of course, more and more things are permitted, we enter different phases of unlock. Hospital visits, OPD facilities, all of these are now open, even encouraged. Yet we find that patients are extremely, worried about whether it's safe, especially when it comes to doing tests. What are some of the steps that have been taken? I think let's begin by asking our panel of expert doctors that. So Dr. Sinha, if I can come to you first, specifically, what about ECG, EEG kind of procedures in COVID times? How are they done and is it safe?
I mean, ECG is perhaps the most common investigation that is done in any cardiac patient. And practically everybody coming to the OPD requires an ECG one time or the other. So although it's a simple investigation, but it requires a lot of precautions to be taken in these difficult times. So in ECG, we have to see that there is a patient, then there is a technician, and then there is the machine. So the patient, besides having the mask and possibly the face shield on, and after sanitizing their hands, they lie down on the couch, and the technician, who is in the full PPE kit along with face shield and mask, does the ECG and takes care to do minimal touch technique. Now the leads of the machine, because the machine has to be sanitized at the start of the day, and at the end, before the next examination is done on another patient, the lead cables, they need to be sterilized again by just spraying the solution. Now suppose there is a suspected patient where we have a high degree of suspicion that this patient may be COVID positive. So then we use a plastic shield between the patient and the machine and the technician, and there is a provision of a sleeve through which the cables can be taken out and put on the patient, and then the ECG is done.
What are some of the logistical things that are put in place, to minimize the risk of infections?
At the outset, let's salute and thank immensely all the healthcare workers and personnel for their extraordinary services rendered so far, and pronounce to all those souls who have laid their life trying to save others. Having said that, when we ask about usage of the infrastructure or utilizing, it's a kind of a catch-22 situation. Patients have no choice, they have to come, but they're so much afraid of what can happen, apprehensive about what will come out. There are so many factors which the patients probably try to ignore, like the way they travel, the things that they carry, and the things that they touch without, reflexively, right, and proximity to strangers while traveling. So what I tell them, best thing is take care of your travel from your home to the clinic. At the clinic setup, all you have to do is certain concepts I have talked about. The first one is about face mask for all. The second one is about the concept of one-way traffic. In almost every healthcare facility, entry and exit is the same. I've been telling to some of the architects, the entry and exit should be separate from now on. It should be the new norm. And finally, we must educate everyone, whether they're patients or not, in a convincing manner about how they should behave with themselves, with people around, and when they come to the clinic, and assure them and allay their fears.
Dr. Ravi, if I can come to you, can you explain, how a consulting room, for instance, is kept safe from COVID-19 infections? This is the space where numerous patients, do come to get themselves physically examined. What do you do?
My room is well ventilated. I open all doors and windows when patient comes, and I do sanitize periodically. I protect myself to prevent virus entry into me through mouth and nose with this mask. And I protect myself with the glasses and also this face shield. Then for patient, I tell patient to wear mask but well sealed. Then I make them sit at a distance in a non-movable fixed sofa. I give patient digital prescription. I won't give papers. In this way, I protect the consulting room with well ventilated, protected myself, protect patient at a distance, and also no transmission with paper.
Let me come to you, Dr. Sinha, at this point. As the unlock process has in fact started, people have started going back to work. Can you share your opinion about the idea of working from home versus going to office, especially for people who have the option? There are several people who don't have the option and therefore have to go back to their workplaces. But what do you still recommend one does?
Yeah, you said very rightly that not all of us or not all the people can have the option of working from home. But yes, I think the world is changing, the concepts are changing, and the working practices are changing. But yes, you are right that this can't be done in all the cases. It is certainly preferable if people can avoid contact. So even if you are called to office or even if your presence is mandatory there for whatever reason, then you need to maintain distancing, have a mask and a face shield. What we fail to understand that a mask alone does not offer 100% protection. So you need, besides distancing, to have a proper mask, wear it properly, use a face shield, and maintain social distancing as far as possible. And even if meetings are to be done, I have seen many offices carrying out virtual meetings, even if they are not at home, then from their cabins. So, I mean, that has to come in our habit now, that we have to take these precautions for the next many months at least.
Dr. Shekar, would you like to talk about the role of UV radiation in sanitizing large areas of clinics and hospitals? There have been certain studies that have talked about UV radiation being used to sanitize objects, but what about sanitizing larger areas, and can they be effective in hospitals?
Okay, I will give you two concepts and go to UV radiations. The first one is the air quality measures that you have to take, as Dr. Ravi was talking about. Two techniques have been used nowadays. One is the air filter concept of HEPA filters, high efficiency particulate filters, which have very good way of filtering many of the viruses and bacteria. The second one is negative and positive air pressure rooms, where negative air pressure, the contaminated air is sucked out of the room with exhaust systems which are built with filters and probably UV lights that I come to, which will, disinfect most of it, and the air is let out into the atmosphere. As far as UV radiations or ultraviolet, everybody knows there are three bandwidths of so-called wavelengths: UVA, UVB, and UVC. A and B we all know because it comes and touches the earth and also our skin and all that. UVC gets literally taken off by the ozone layer in the earth that we live in. Whereas in 1878 they found out that UVC, that small, very narrow bandwidth of UV radiation, is very effective because it's filled with a lot of energy. Plus it has very low penetration. It doesn't go beyond the very thin skin of human beings, and
right,
it's extremely good in killing the DNA material.
Okay.
So it's very important.
Okay.
And there are lot of gadgets, bulbs, containers, and now you have booths, towers, and so many things are there. I think we have to start using.
All right, very interesting revolution there. I think that's definitely something that more and more people would like to now study and investigate and perhaps explore possibilities. With that, we're going to slip into a very short break. Our panel of expert doctors will be live with us on the other side. Do stay tuned.
Knowledge Partner, USV, your reliable healthcare partner.
Welcome back. You're watching Living with COVID. Our panel of expert doctors continues to be live with us. Dr. Ravi, if I can come to you. It's been seen that many patients who are COVID-19 positive also exhibit high blood sugar levels. Are people with diabetes therefore at a higher risk of COVID-19?
There is not enough data to suggest that diabetic people are more prone for COVID infection. But in diabetics, especially long-standing diabetes, the immunity will be less. In those patients, the chances of getting COVID are more. In COVID infection, in patients with diabetes, it's an infection and triggers inflammation, and also it triggers a lot of hormones that increases blood sugars a lot. So patients with diabetes are more prone for worse outcome than general population. In diabetes with COVID, that inflammation will have very bad effects, and outcome in diabetic patients are worse when compared to other people, especially uncontrolled diabetes. And also treatment with the COVID infection needs some steroid at one point of time, and these steroids also, like methylprednisolone and dexamethasone, will increase blood sugars a lot. So COVID in diabetics, the sugars will shoot up like anything.
Dr. Sinha, the other big issue that is of a huge cause of concern to a lot of patients right now is, what about elective surgeries? What's your advice to them? What are the kind of surgeries that can be done? What should be held off? Is it safe to get yourself operated in the midst of this pandemic?
We usually advise the patient to wait if the patient is low or intermediate risk. Only if the patient is high risk or there is an indication that the patient's condition is not well, only then we tell them to come over. And I think everything has to be planned differently also. We tell the patient to come with the minimum baggage, with minimum attendants,
right,
and don't carry all the records. Take a snap or sort of have a WhatsApp on which they can store the records instead of carrying their files and x-rays and this and that. And then we usually try to keep them in the hospital for as short a period as possible. So many of our patients have a daycare procedures. We can admit them in the morning and discharge them in the evening. And even if an angioplasty or a multi-vessel procedure is done, then we can discharge them next day morning. So we try to shorten their stay and take all the precautions to keep them away in a safe place in isolation rooms so that they don't get exposed to other patients walking around in the hospital. Now, it's also very important that the patient, all these patients understand that if there is an unforeseen problem and they need to sort of rush into the hospital, they should be mentally prepared for that. Mentally, I mean, they should have a contact with the hospital, with the doctor, and perhaps even in some cases, I would say in remote areas, they should have a contact with the ambulance service so that no time is lost if the person needs to come in an emergency, in an unforeseen circumstance.
Dr. Shekar, people are under a lot of stress because of COVID-19. There is a fear of contracting the infection. You fear for yourself, you fear for your family, you fear for your loved ones. What's the kind of advice that you would like to give people to be able to manage this undue stress and pressure at this time?
We talk about stress. Well, as far as frustration, anger, anxiety is concerned, there are two types of stress: eustress and distress. The so-called stress that we are talking about is distress. We get angry, we are anxious, etc. But there is an eustress, that is, I like my family, I love my children, I love my wife, I love my friends, and I love the way I live. when you use stress, your so-called anxiety level comes down. So I keep telling them, try to be a little bit calm, etc. Try to like what you do and try to love the things in and around and the life you have. The stress comes down. But beyond this, you need a specialist help. This is a simple solution that I can offer.
Dr. Ravi, if I can come to you then, what's the kind of advice that you'd like to give patients who are suffering from diabetes? How can they manage their diabetes conditions at home, and what are the extra precautions that they need to be taking to protect themselves from COVID-19?
Diabetic patients need to take extra attention to their blood sugar values. If the sugars are very high, they need to control. They need to call their doctor, and at least by phone they need to tell the doctor their sugar values. And better they should have one glucometer. They can check their blood sugars at home. If sugars are low, they need to decrease the dose or take a timely food. All diabetics need to take a frequent meal. Every 3 hours they should eat something. And if the sugars are going down frequently, they need to call their doctor at least by phone. We at our center, we are having some tele-consultation with the patients. If they got diabetes also, we call them by phone. We know their sugar values and adjust their sugars periodically. In this way, tele-consultation is very necessary at this time. Those diabetics should take water. They should not get dehydrated, and they should take regular medication. They should do daily exercise at home.
Dr. Sinha, if I can come to you at this moment, there are symptoms like breathlessness that are common between cardiac diseases, even between a whole host of asthma patients as well as COVID-19. How does one differentiate between what is routine and what is COVID-19? Also, it can be seen that cardiac patients are at a higher risk of developing complications. So what are the kind of precautions they should take?
We should understand that patients can have a respiratory and a cardiac problem beforehand, pre-existing. They have a more than a fair idea of what their pre-existing illness causes symptoms like. So they can recognize that. So if they are the same symptoms, then they should first think of an exacerbation of the pre-existing illness, which may be a cardiac or a respiratory problem. However, if the patient is having some fever, body ache, sore throat, and then having breathlessness or a wheezing, then certainly patient needs to go for a checkup, early investigation, so as not to miss the COVID virus infection. And as you very rightly said, patients of heart disease have at least a 30 to 40% chance of having more cardiac complications during these difficult times. Now, it's not very easily explainable as to why this is happening, but one is that I would agree with the other two panelists that sometimes there is a panic and the patients may stop or even change their medications on some advice which may not be really scientifically given to them. So they may stop their medication, they may change, they may neglect other healthy lifestyle habits like monitoring your blood sugar, monitoring the blood pressure, having a good balanced diet.
Dr. Shekar, a lot has been said about masks. There is now a new advisory on N95 masks as well. Two questions. One about what is the kind of mask etiquette that must be followed, because all doctors say that, using a mask is important. What's even more important is how you dispose it or how you wash it. So that's my first question. And the second part of the question is, do we all need to wear 3-layered masks? Should we be creating them and only be wearing them? What are the kind of masks that are safe?
The mask should cover your nose and face from ear to ear. And whenever you wear a mask, there is always a space between the nose. You better put a glass. If you do not have any vision problem, use a zero glass and put it, and it will close it. This is the first one. The etiquette is, don't keep touching the mask like that. You want to open the mask, take it out like this and put it back. Don't touch this. Like this, there are a lot of concepts. But important is wearing mask should be universal whenever you are out of your home and if you are a healthcare worker when you come home. There are so many more things. I'll curtail it here.
Right.
When it comes to the concept of the materials, there are two types for general discussion. One is called medical mask, the N95, KN95, all those. We'll forget about it. The other one is community mask, where I personally feel it should be a 3-layer or more. I keep telling many people, especially my postgraduates and doctors, 3 layers should be different. The stuff should be different. A cotton, a flannel, a chiffon, a silk. For example, you have 6-thread count good quality cotton. That's the most important. It should be tightly woven cotton, then a silk or a chiffon layer, then another, the banyans or t-shirt cotton, which is soft and it absorbs moisture. These 3 would be very good. It should close your face in a nice manner from ear to ear.
All right. And what about disposing and washing masks? Would you like to address that as well? Many people are using just cloth coverings or cloth masks or handkerchiefs. Are those safe? And how would you advise that they are sanitized?
See, those kerchiefs and bandanas are the least. But let me make a statement. I may be, pulled up for many professionals. Something is better than nothing.
Right.
Not wearing a mask and wearing a, that is the incremental level we talk about. But the 3 layers that I'm talking about can be reused.
Right.
They have to wash it in soap water, either warm or normal water, dry it, and then if you want, you can iron it in a high this thing and keep using it.
Okay.
When you think that it is not working because there is some space between your face and the mask, buy a new one.
All right. Very interesting advice there, I think. And how to use masks and what kind of mask should be used is a question that a lot of our viewers definitely needed answers to. Thank you so much, doctors, for sparing the time of day and answering our questions.
Knowledge Partner, USV, your reliable healthcare partner.